Good afternoon, and thank you for joining Inside Women's Health with Dr. Margie Corney and myself, Belinda Pitts. Today we will be discussing what happens at your annual GYN exam. Dr. Corney, many women are not familiar with what takes place when they go into their gynecology office for their annual exam. Will you explain to our listeners today what do you talk about? What do you do? What type of examination is performed to these women when they're there?
Okay. Well, very good question, Belinda. Annual GYN examinations, it comes up many times that women need to have some type of assessment on an annual basis, different reasons for younger women as opposed to older women. Typically, an annual GYN examination will incorporate a physical exam that will normally involve a breast exam, an upper body evaluation, and then a pelvic exam. The pelvic examination, hopefully I'll go into that in a little bit more detail, but that physical examination usually involves physical assessment as well as a conversation, social history taking, family history taking, so that way we can gain a little bit more information about our patients, what has happened to them throughout the year since they were seen last time, to try to get a better idea about how to best care for the patient. So physical examination, as mentioned, breast exam and pelvic examination. The pelvic examination is twofold. The pelvic examination involves speculum exam as well as a bimanual examination. And a lot of people call that speculum examination the exaggerated and the infamous come down to the end of the table and we're going to use a instrument. Well, it's not that bad. It comes in different sizes. Most of the time, the whole objective of that speculum examination is for us to gain access, visualization of the inner aspect of the vagina. In particularly, we're trying to see the back portion of the vagina, the cervix, and the vaginal walls, as well as the external portion of the person's body, include the labia, the vaginal opening, and the perianal area. Once we do that speculum assessment, once we have access, we're able to do some tests. One of those tests can be, and most likely is, a pap smear.
Okay, Dr. Corney. So we discussed last week that the recommended age for a pap smear is at the age of 21. Initial pap smear. Now, what if that person has not been sexually active? Would you still do a pap smear on them?
Well, it's generally accepted that some type of assessment in the form of a pelvic examination and a pap smear be initiated at your 21st birthday. It's not an absolute requirement that a pap smear be performed, but generally speaking, we do a pap smear. Typically, the pap smear is designed to screen for precancerous abnormalities of the cervix, and I underline precancerous abnormalities because the pap smear is not designed to find cancer. We're trying to determine that there is an abnormality that would inevitably, if untreated, lead to cervical cancer. So the whole idea is intervention. We want to be able to evaluate a person and treat a precancerous abnormality if it is discovered, so that way this patient will not have to deal with the consequences of cervical cancer.
Okay. Now, you mentioned that you take a social history as well as a physical history. Why is it so important to have the patient give you or answer questions in regards to their social behavior or their family history?
Well, that's a pretty good question. Being a physician, we learn so early into our careers how important it is to know the entire patient, the entire person. And so things that involve your social life will impact your physical. And so we really need to try to know our patients as best we can. For example, if a patient is a smoker is at great risk of having premature menopause. a smoker is at great risk of having thromboembolism, and these are some of the things that might prevent a person from being able to use the birth control pills as a birth control method, or it would put that person at greater risk. So something as simple as, and maybe a lot of people wouldn't think that it's simple, but some women smoke, and they smoke very intermittently, but they do smoke. And this is a problem that needs to be determined at that annual GYN examination when we're doing our interview and trying to learn as much about our patients as we possibly can.
Okay. Now, how important is it for a patient to know their family history?
I would say that it's extremely important. That's going to guide the doctor in trying to determine whether or not a test is necessary to be performed sooner than later. Is it consistent with normal guidelines handed to us by different organizations? Or is it something that we need to go outside of the guidelines because this patient is at greater risk? And you may know that we encountered that kind of situation just recently in the office. A patient had, without mentioning any names, a patient had her mother recently diagnosed with breast cancer, and this is a young patient, and she was in her 30s. It's recommended that you start having your mammograms at age 40. However, in this patient, I recommended that she start doing her mammograms earlier than her 40th birthday because of her very strong family history, her mother being diagnosed with breast cancer very recently.
Okay. Now, speaking of breast cancer, I know it. What I want to ask.
That's okay. Menstrual cycle?
Menstrual cycles. Patients come in all the time scheduling appointments because they're having abnormal menstrual cycles, or I've had my cycle twice this month, or it just went off and it came back on. What can you tell those patients? What do you recommend for them?
Well, first, it's very important to know what a normal menstrual cycle is in terms of its pattern, in terms of duration, as well as onset. Typically, a normal, regular menstrual cycle is considered regular if it occurs every 21 to 35 days. So you could have a period that starts on the 1st of March and comes back again on the 29th of March, and that particular interval is considered to be a normal pattern. Now, granted, the period is still there's two periods in the same month. They both start in the same month, but that's still considered to be a regular interval between a menstrual cycle. The period duration can be anywhere from 5 days, 3 days, to up to 7 to 8 days. So the timing of the period is usually counted from the beginning, the first day of one period, and it's counted from that date to the beginning of the next period. So sometimes women, patients, decide, well, I'm going to go on and count from the time that period ended until the time that the next period comes. Mm-hmm. When that's not the correct way to actually monitor or to measure the distance between periods. But normal period should be anywhere from every 21 to every 35 days. Now, that doesn't mean to say that you couldn't have a period that is typically every 33 days and then have a period that comes in the 28th day. It does happen. So what's considered to be regular and normal for you is what your period pattern is most of the time.
Okay. So if a woman is experiencing what she may think is an abnormal cycle, she can get a calendar.
Yes.
And monitor her days.
That's a good thing to mention. I know it sounds kind of quirky or crazy or maybe a little bit odd, but a lot of young people nowadays, they keep track of their menstrual pattern on their phone. And there are different apps for monitoring the pattern of your menstrual cycle. Whereas when a patient comes to my office and they're considering or they're coming with the concern or complaint of irregular period or some problem with their period, I normally have them do a menstrual calendar, because a menstrual calendar, in addition to giving me the onset, the duration of the period. It also will give me an indication of the quality, the characteristics of the period or the bleeding pattern, because we normally have a patient write down whether or not they're having a light flow or a heavy flow or a spotting. So it's very helpful in trying to determine what the characteristics of what that patient considers to be an abnormal bleeding pattern.
Okay. So we've talked about the abnormal bleeding pattern. What about abnormal bleeding? I've had some women to call in and say, I'm on my cycle and I'm passing huge clots and I'm going through this many pads. What would cause an alarm, or where that patient may need to seek some type of medical treatment when that flow is just very heavy?
Yeah, well, that's a good question, because for most women that do have heavy periods, they might not even recognize that they have heavy periods because it's been a prolonged period of time that they've experienced just heavy periods, that they've gotten used to it. Mm-hmm. But if there was an alarm that should be raised or a patient should be alerted, is if she's bleeding for greater than 10 days at a time, and there's what she is concerned about is a heaviness to a period. It only really matters that she's concerned. And if that concern is alleviated by explaining to her what the pattern is and what's normal, what's not normal, and if we can possibly do some tests to try to determine whether or not the patient is anemic as a consequence, then we have accomplished something. But the most important thing is to have a consultation with a doctor so that way we can be reassured that this pattern is normal. Now, you mentioned a very important topic, what might be the source of abnormal bleeding. There are multitude of reasons why someone may have an irregular bleeding pattern, and it sometimes is dependent upon, or we have more concerns dependent upon what age group that patient has this abnormal bleeding. If I may, an example would be a patient that comes in and she is 22 years old and she is using the birth control pills, and she's concerned about bleeding in between her period, compared to a woman who is in her 40s not using the birth control pills and comes with a history of having a period that lasts for 14 days. It's possible that the young woman that is using the birth control pills, her menstrual pattern may be controlled by the birth control pills or influenced by the birth control pills, whereas a patient that is in her 40s that is not under the influence of the birth control pills, we're extremely concerned that there might be some underlying pathology as the reason for her abnormal bleeding, and that young woman would definitely need to have some type of investigation in the form of possibly a biopsy of her lining of a uterus, also called the endometrium.
Okay. Well, thank you very much, Dr. Corney, for answering our questions. Now our listeners will know what to expect at their annual GYN exam and what questions they may be prepared to ask in regards to irregular cycles, abnormal bleeding, prolonged cycles, short cycles. So we thank you for
before we wrap up, Ms. Belinda, I did want to, I think, hopefully I was complete about that physical exam, but I want to make sure that we definitely touch on the topic that the annual GYN examination may be the only type of examination that a female patient is having. She may not see any other doctor. And so it's extremely important that a woman who is in her 20s, from 25 up until 45, that she definitely see a doctor, and that doctor may not necessarily be a gynecologist, but she see a doctor and make sure that her pap smear is performed and that she does a physical examination that includes a breast examination, including a patient be made to be aware that it's extremely important to do her self-breast assessment, to try to get familiar with her breasts. And while I'm saying that, I'd like to also mention that a lot of women have very much concerns about how to do that breast exam. And I just want to make sure that you know that it's not important to be an expert at doing a breast examination. Your breasts are with you all the time. What's important is for you to gain some type of familiarity with your breasts. So you do that little assessment. Look at your breasts. Try to be symmetrical about evaluating your breasts. Don't be concerned. Don't be afraid that you're going to miss something. It's not you alone. It's yourself as well as your doctor that's trying to make sure that you stay as healthy as possible. But as long as that physical examination includes a consultation on how that patient's doing from the perspective of knowing what other stressors might be in that patient's life that may influence her health, this is extremely important that you not hold back when you're talking to your personal doctor. Get in there, have a conversation, tell them everything that may be of a concern to you, and see whether or not this is something that the doctor might think is significant and might want to do other things to try to help you get through that stress. So I'm sorry to interrupt, Miss Belinda, but I just wanted to make sure that our patients and our listening audience knows that it's very important to have a good relationship with your doctor. And if your questions are not being answered, you need to make sure that you be a little bit more demanding about having your questions answered.
Awesome, Dr. Corney. Well, again, we thank you for answering our questions for our listeners. And now, hopefully, they will be better prepared for when they go in for their annual GYN exam, and they'll know what questions that they can have ready for their doctor in regards to their cycles, in regards to any abnormal bleeding that they may have.
We love questions.
Yes, we do. Again, thank you to our listeners for tuning in on today. Visit our website at www.obgyn-va.com or like our Facebook page at Inside Women's Health with Dr. Margie Corney. Again, stay beautiful inside
and out.